Hi, we're going to get started now. We're still missing one presenter, so we may juggle things a little. And I didn't mute everyone because we were having trouble with some of the presenters unmuting themselves. So if you're in a noisy area or just, if you're not speaking, please press *6 to mute yourself, and you can always press *7 to unmute yourself if you have a question. So thank you for joining us today. Today's webinar is If I Knew Then What I Know Now, Lessons and Experiences from the Early Pritzker-Funded State Grantees. So the idea is, to pass along things that people learned along the way. And, it's just a chance to hear from the 5 states who started earlier than you 14 planning grantee states to share what they learned in the process. Before we jump into the content, I wanted to make one apology, one logistics announcement, and one point of gratitude. The apology is that for some reason, not every state had their full coalition invited to the webinar. There was some kind of problem with the list and ReadyTalk, and I believe we fixed all that now. Our intention is to invite all of the Planning Grantee Coalition members to the Planning Grantee webinars. So I'm very sorry for this error. I think we've got it all corrected now, but keep letting us know if something seems amiss in terms of any invitations to webinars or other events. On the logistics front, I know I sound like a broken record, but if you are not presenting, press *6, and that will mute you. And then you can press *7 to unmute yourself if you have a question. You can also write questions in the chat box. And in a few minutes, I will enable the chat box so that everyone can see each other's questions, because you can also answer each other's questions or comment on each other's questions if you'd like. And then the point of gratitude is I've gotten, and many people working with the Capacity Building Hub have gotten lots and lots of questions about what is the size grant that you can apply for. So our point of gratitude is to the Pritzker Children's Initiative, obviously for the big way that they're focusing on prenatal-to-3, which is so important. But specifically today, we're grateful that the state grantees received the information yesterday about the size of the potential 3-year grant that each state coalition can apply for. That way I'm hoping that that will not be the only question that comes up on this webinar. So I'm going to jump right in. As I said, the 5 of the yellow states are the early states in this process with the Pritzker Children's Initiative, and they're going to be sharing some of what they learned in their planning process as they were creating their prenatal-to-3 policy agenda and action plan. So they're your forerunners and people who you can turn to about what they did in situations that you may now be facing. But I want to make one point to think about and remember as you hear from the presenters today. They entered their relationship with the foundation, the Pritzker Children's Initiative, differently than you did, and sometimes differently from each other. You 14 states all had the same grant guidelines about your coalition, for example, but the 5 earlier states didn't. They, North Carolina and Oregon entered first, and they had multiple grantees, whereas Ohio and California entered last of the 5, and they had 1 lead grantee. So even amongst themselves, their context for preparing the policy agenda was different, and you'll hear a little bit about that today. So it's not hearing about apples from apples, but definitely there's some relevant learnings. So we're going to hear today from California. Moira Kenny is here with us, and she's going to share some about California's experiences in this process. She's the executive director of the First 5 Association, where she's really helped to refocus the association's efforts on collaborations with all the other child advocacy organizations in the state and deepening the engagement of First 5 at the state level. And then To her right is Abja Mita, who's the Deputy Director of the Education Trust in New York. So she's going to share some of the experiences that the New York Coalition and team have had. She leads the Education Trust New York's work on eliminating gaps in equity, opportunity, and achievement, and she led the planning process for the prenatal-to-three policy agenda there. And then below Moira is Michelle Rivas, who's the Policy Director of the North Carolina Early Education Coalition. They're a statewide early childhood advocacy association and have state and local organizations across North Carolina. She's a big bridge, and North Carolina is a good example of bridging efforts between the Pritzker work and the 0 to 3 efforts, since Michelle also serves as the project director for Think Babies North Carolina. And then to her, well, on the right, to the right of her, as you look at the screen, is Lynanne Gutierrez. She's the policy director and legal counsel at Groundwork Ohio, and supports Groundwork's work to advance access to quality early care and education. Groundwork's an organization that you might want to go check out on the website and learn more about their racial and rural equity work as well, which we probably won't get into a lot today, but will be interesting and relevant to your planning work. Then last, in terms of states, we have David Mandel and Dana Hepper, a little public and private sector duo. David is the prenatal-to-three system fellow at the Early Learning Division in the Oregon Department of Education, and he was the acting early learning system director in part of 26 and 2017. But he's no stranger.
Around 3:30%.
But he's no stranger to the advocacy world. He spent 7 years at the Children's Institute, where Dana is the director of policy and advocacy. Dana oversees the Children's Institute's legislative advocacy and community engagement work. So, and I'm Susan Hibbard at the bottom of that screen. I'm the executive director of BUILD, and BUILD is the host of the National Collaborative for Infants and Toddlers Capacity Building Hub. So now we'll jump into
Well, if you feel we need to meet, I can do
David,
that. If you can
you,
feel you can go ahead without me, that's fine too.
Okay, hold on. I think that'll help. We asked you to share your questions with us, and we picked the ones that seem to be the most pressing to organize this conversation. We may have time for others, and you can both ask them in the chat box, and you can also, I'll also draw from others on the list if we don't run out of time with these questions. The question that many of you asked was, how did you structure your coalition or your policy agenda planning group? You're just at the point of structuring that, and so I thought it would be great to hear from some of these states. Lynanne, do you want to start with how Ohio structured its planning group?
Yes, absolutely. Hi, this is Lynanne from Ohio. I just want to, as a follow-up, if there's any additional kind of resources or templates that you'd like to look at from what I'll reference, I'm happy to send those over. By way of context, Susan mentioned that Ohio and California came on after the initial, a little bit after the initial group of states. And so we benefited from some of their learnings, but you should know that in Ohio last year we had a gubernatorial election, and so we, as the only statewide entity focused on early childhood issues, alongside in a partnership with the Ohio Children's Hospital Association, had already developed a high-level policy agenda focused on 0 to 5 around kids' early child care, education, and health. So some of our kind of reflections or framing around the work was already kind of building up last year, and you'll see that reflected here. So we decided our real planning work started in January of this year, and we felt that let me try to advance the slide here real quick. We felt that this setup of monthly, we committed to do 6 monthly in-person meetings, and then committed to follow up smaller stakeholder conversations in between that to keep the work advancing, But keep in mind, I'm sure as many of you know, like our folks are traveling all across the state to meet with us, and I do think there's incredible value to have face-to-face meetings. We did not actually have a phone alternative for our in-person meetings for that reason, and we are really driving attendance to get everyone in the same room talking. Our planning is also happening at the same time as our state budget deliberations, so we really needed to be intentional about our agendas to allow everyone to kind of not suspend reality, but we've gotten too used to getting so in the grind of perhaps fighting over crumbs and those incremental steps in the budget, but actually to bring us out kind of above that to be able to look, okay, what is our long-term strategy? What is the vision that we're trying to create for infants and toddlers? And so these 6 bullets reflect our 6 in-person meetings. The first, of course, was introductory. Many of these were familiar faces to one another, but there were definitely some new faces, and many times similar people, but seeing each other in a different role. You have child care leaders who, we never even knew to the depth of perhaps that they were also invested in home visiting. And so understanding kind of everyone's collective experience around their 0 to 3 work and how they view that was really important. And then the second, third, and fourth meetings, February through April, were substantive policy meetings. And we, on the front end, because of our high-level agenda and our work before this Pritzker planning grant, we felt it was important to drive focus around these 3 main buckets that reflected our governor's focus as well, and actually mimic some of the language that is being used in our state policy landscape. So we weren't totally reinventing the wheel, but trying to bring the 0 to 3 focus to these 3 buckets. So quality infant and toddler child care, what we call supporting the healthy development of infants and toddlers and responding to early childhood trauma, which really is a menu of policies driven to infant and early childhood mental health through the Medicaid, the Medicaid field, and then also evidence-based home visiting. And so then we're able to take advantage of the Pritzker team's communications workshop in May, which helped translate our policy agenda in the beginning to think about, okay, what does our implementation look like and what are those activities we're doing, both at a high level and more at a task-specific level to implement our policy agenda. And then lastly, we've actually pushed this last meeting to July because our budget will be over in July and we can make any adjustments from there as kind of a final report out of what our policy agenda looks like. We've gotten feedback ongoing around that, but also what the implementation plan looks like, so everyone feels comfortable with that. This is just an example of our of an agenda. This one in particular was what I set up for evidence-based home visiting. Again, being really valuable or being really respectful of people's times. We typically started with the meeting structure with an update. This particular day, I remember I got to share about our BUILD technical assistance and what that meant as a resource. And as a note, before every meeting, I talked with Susan in advance, and she connected me to others who could provide resources that were targeted based upon our kind of state policy landscape that could be given to the group in advance on these substantive policy areas. So we got the brains and wheels thinking about these issues before we entered the room, and it kind of created a common language for us as a starting point. Of course, we also had state-specific resources or things that we wanted to share from a data perspective with them as well in advance. Then I think the third big part of the agenda you'll see here, which we spent our first half of our meetings including in, was focused discussion around shared values. So we have a mission, vision, and guiding principles, and had the coalition pledge to these shared values. And each substantive policy meeting, we were already very specific about what our goal. We made no apologies about our commitment and the Pritzker Children Initiative's expectation that our goal was serving 50,000 more 0 to 3-year-olds in our state. And so for this meeting, we were translating what that meant for evidence-based home visiting. So I provided kind of a 101 with data to level set the room. And then we had a substantive presentation by a consultant we hired who has a lot of experience working in Ohio in the Medicaid field, because we thought that was really important, because one of our primary strategies has been to try to finance home visiting through Medicaid. So you'll also see that we tried to focus the discussion. We kind of anticipated or telescoped the biggest areas of concern around home visiting that we would need to have specific strategies, which included building the home visiting workforce, in addition to that financing piece to keep the conversation focused. And then, of course, next steps, you'll see we created a survey that we sent out to our whole network to help inform some of our work, but we also had follow-up surveys to our key stakeholder groups. So anything that didn't happen in this particular planning meeting, or if we needed some follow-up answers around scheduling or around research or certain issues, we could get that response via survey as a follow-up. I think I will leave it for there. We're now in the process of translating our policy agenda to the final implementation plan in the format that Pritzker is requesting it. But I do think we've been successful in being respectful of people's time and making it valuable by driving, being the leader and driving the conversation around our very specific goals. Thanks.
Great. Thanks, Lynanne. And now I'm just going to answer the same question from the perspective of New York.
Sure. So hi, everyone. So in New York, we have 2 PCI grantees, the Education Trust and the Rockefeller Institute of Government. The Education Trust has been leading the development of the policy agenda, and the Rockefeller Institute has been part of that process, but they've also been working on a separate project. We got started last June, and our planning committee largely consisted of advocacy groups, including a mix of statewide and regional organizations. We were very mindful to try and have a balance of upstate and downstate organizations to have that balance as well, given the state dynamics. We included some provider perspective, in particular childcare and healthcare representatives. And then we had this larger planning committee, but then we also over time developed a smaller policy agenda work group that took the lead on drafting and revising the policy agenda based on the broader feedback. In terms of the meeting structure that we used, we went with a mix of in-person meetings, video conference meetings, and phone calls. We had between June and January, we had about 4 in-person meetings, including the opportunity to meet as a state at the Pritzker-sponsored convening in Raleigh last summer, and then had a number of in-person meetings. But we also then listening to a webinar. Ended up using some video conferencing since we did have a bulk of our members here
next week, since we're in June.
Bring in people that way and accommodate schedules.
But promoted codes.
It seems like someone is.
So Jill did the majority of those numbers.
And not muted. But okay, I think that should be taken care of now. So in terms of just in terms of how we kind of guided our meeting discussions, we developed guiding principles early on, which helped to facilitate the discussion and the development of the policy agenda. We also conducted a landscape analysis really early on, so last summer, and shared that with the Planning Committee. And the findings from that landscape scan helped to also inform the policy agenda development. And then we conducted focus groups about halfway through the process. And those focus groups are with parents and providers, and that helped us to refine the policy agenda. I think at the point that we had done the focus groups, we had already started to sketch out our priorities and high-level policy strategies. And then as this was going on, the work group held a number of calls to review, revise, and really flesh out drafts of the policy agenda that were then shared with the larger committee. We also had a really great one-day workshop with GMMD on messaging and communications. And that was conducted in January once our policy agenda was further along. And so that's just a quick overview of what our planning committee structure and process is like, and happy to answer questions later on as well.
Thanks, Abja. I'm hoping that we have Michelle. Michelle, can you?
Yes, hi, this is Michelle.
Okay, great.
Great. So I don't know, things stopped and now they're starting again. So, but I have the slide, so I'm hoping this is working.
Yeah, just tell me when you want me to move the slide and I'll do it.
Okay, great. So this is Michelle from North Carolina, and I'm happy to share with you some of our history. Sort of odd to talk about this in just such a short period of time, but we were one of the first states. We actually got funded by Pritzker in March, and we started in May of 2018. So as Susan told you, there are 3 different organizations funded in North Carolina: the Early Ed Coalition, the North Carolina Early Childhood Foundation, which is a nonprofit known for some policy work and communications work, and then our North Carolina Department of Health and Human Services Division of Child Development. And the interesting thing for us, which I think is very different for all of you, is these were independent applications that were put in. Even though we were talking to each other, we did not have a consolidated application. So it took us some time to form and figure out what we were going to do together. But by May, we had it together, and our charges were to create, from Pritzker, were to create a policy agenda by September 2019, and then develop and implement a strategy for our policy agenda accomplishment for our 2019 legislative session. So to do that, the 3 funded partners, we formed a steering committee. We added 2 early childhood partners in our state that are well-renowned and regarded for their work, and really should have been part of the original funding team if we had put it together that way. Next slide. So this is a structure that the steering committee came up with. We formed a state-level Think Babies leadership team. At the same time that we received Pritzker, the coalition also received funding from 0 to 3, and we all agreed quickly that we liked the Think Babies brand. So we went with that. And our leadership team has 20 different state-level agencies involved. It's really a mix of public and private agencies. In addition to our Division of Child Development, we also have public health, and we also have our governor's office participating on this team. And then we have a few, 2 or 3 actually, local partners who are also leading on early childhood issues in a networking kind of way. So as we decided who we would invite, this is not an open process in our state, we looked for leaders who had expertise and influence in infant-toddler issues, and really they came from the early childhood world, not specifically infant-toddler. Influencers, so we were looking for people who could provide leadership on issues, certainly provide some credibility for the work that we were doing because it was brand new. And we also wanted to make sure we had networkers and advocates on the team. So every member was, we sort of interviewed or knew what their capacity was for bringing a bigger network of folks. so we could make sure we had stakeholder involvement, and also continue to work forward on advocacy and legislative advancement. And then we asked, this wasn't a criteria that we held to, we asked people to make a 2-year commitment and to attend the meetings in person or have their designee attend in person. We had no online meetings or on-phone meetings for the whole first year of our work because we needed to build those relationships and get going really quickly. Needless to say, we brought a lot of people to a table that they had never been to before, even though most people had worked on early childhood, but we built a cross-sector team, so we have child health, early care and learning, and family support organizations, many of whom had not worked together before. So we hired a facilitator to guide our work, keep us on track. We all felt we had an impossible timeline. And then our organization, the coalition, served as a backbone organization, and that was really critical to keeping everybody, looped in and networked and able to work together and all the meeting logistics. Because we met for the first 6 months, believe it or not, we met twice a month, and sometimes we had committee meetings as well because of that deadline of 5 months max to get to a policy agenda. So I think I have one more slide.
Yeah, Michelle, before we go on, we've gotten a question that I'm just wondering if you can respond to. How did you engage rural representation within the state if you didn't have any online or phone options?
Well, certainly the organizations that we had at the table had statewide networks, right? And then specifically in our local networks, we included a organization from the western part of the state, the central part of the state, and the eastern part of the state. So it was really through those 3 regions were represented, if you will. North Carolina is a big state, but, we knew that each of the partners at the table had the ability to cross county lines and work rural and urban.
So it was up to the member organizations to do the outreach or get feedback.
Exactly.
Okie doke.
This is Lynanne from Ohio. I was just going to comment on that too because we prioritized in-person conversations as well. But I think if you take a look at what the body of your other work is doing for us, we are traveling around the state talking about race and rural equity and presenting data and getting feedback from local stakeholders. So as part of that, we're also getting information to influence information that was influencing our 0 to 3 policy agenda, and additionally, again, going around the state doing advocacy training and being really intentional about where we were doing that geographically. And so I think that allowed us to trust in the key stakeholders who are representing a diverse geographic span of Ohio, but also knowing that, just because we were in this planning grant phase doesn't mean that our other work couldn't influence or we couldn't learn from our ongoing work with a 0 to 3 lens on to influence your policy agenda. Thanks.
Great. Thanks, Lynanne. Okay, Michelle, structure and governance in North Carolina.
Sure, and I just wanted to say I think that's really important because we had all kinds of other work going on at the same time. So I'm really just talking about the leadership team work here. So basically we went from a 20-person, or actually it was 40 people, but 20 because the designees came as well, to committees. So we required everyone on the leadership team to be involved in a committee, and we formed multiple ones along the way. The ones I'll highlight is we had a research committee. This team was tasked with looking at compiling first to completing the 0 to 3 state assessment. We reviewed dozens of national and state reports to see what other recommendations had previously been made, and also then compiled a matrix of those. And that became the template by which we began to build our policy agenda. We then divided into policy committees around our policy framework, which we had 3 buckets: healthy beginnings, supported families, and early care and learning. The chairs of those committees were added to our steering committee, and then we allowed those committees to just go off and meet by themselves. Sometimes they met during the full leadership team to look at all of those recommendations and bring their recommendations back to the leadership team. So we went from hundreds down to 8, and I'm happy to share those later. And as we got to our final policy agenda, so this is really fast-forwarding 5 months of work, we created a campaign committee that started just this past November. This is 6 agencies, all of whom have a lobbyist or a strong advocacy capacity, and these are the agencies, the organizations that committed to moving the policy agenda forward in the 2019 legislative session, which for us started in January. So we're still at it. So that's a little bit about the structure and governance of our work. We remain today with our steering committee, subcommittees, and a leadership team.
Thanks, Michelle. Okay, so the next question we got was just, how did you organize your planning group in terms of having both the public and private sector and sort of navigating the roles of each of those? And so we'll start with New York. Abja?
Sure. So in New York, we had pretty limited public sector presence in our planning committee. The Rockefeller Institute for Government does have a quasi-public sector role, and so they largely represented the state public sector in our planning committee and had that perspective, and they are the public sector. And part of that, I think, is just New York is somewhat unique in that, given our the political dynamics, having public sector presence in developing a policy agenda didn't quite make sense. We did consult local agency leaders as we were developing our policy agenda. We also had informal conversations with some state agency leaders, and some of our planning committee members also have been involved in state-led initiatives, and so we're able to kind of bring in that perspective based on the work that they were doing with state agencies like the health department and the state education department as well. And so I think going forward as we launch our coalition this summer, we'll be looking for opportunities to cultivate public sector champions and allies who, again, may not actually be formal members of the coalition, but to the extent that they are in alignment, will be in a great position to help advance our policy agenda. And again, and the decision not to include public sector leaders in the coalition is a very conscious one, just again, keeping in mind the political dynamics we have here in New York State and how the funding and budget cycles work. We are, taking more of an approach of allies and champions as opposed to involving in the coalition leadership.
Okay, great. So same question. Let's hear how California thought about what made sense for California in its planning coalition. Moira?
Sorry, I had to unmute. Hi. So again, I will echo my fellow presenters. It's great to have this opportunity to talk to you about what we did, and I will say further what Susan said, we all did in different places in different ways, and so it was really, really interesting to hear from this that went before. We've met them once, but it's interesting to hear some of the details. So I will say, I'm not going to go into any of the benchmark moments in our work. We are less than a month away from submitting our final proposal, so we are deep in that work. But we have a couple sort of these key takeaways. One is that our proposal, I'm so grateful to Jerry and the entire team for really acknowledging that working in California was going to be different, and it had to embrace the reality of California as a very large state and a very local control state. And so we couldn't be successful unless we built on the reality. And in fact, that was both an advantage, it's both an advantage, and it requires some tweaking on both, on everyone's part to be really successful. So we're going to talk about how, which our current structure I'm not going to go deep into that, but I would say that most of you know Health has had dedicated funding for early childhood systems for 20 years now. It's at a local level. So there's nearly $100 million a year that is independently controlled and independently spent by the 58 counties in California, the 58 county commissions, first 5, and their funding is intended to build local systems. And sometimes I will say that's even complicated folks in within California, let alone funders from across the country. So we basically built our Pritzker project on top of the infrastructure that is already in place, that is unique in that it's a public agency, but that are required transparently and in partnership and collaboration with other local private and public partners. Am I advanced slides or no? Susan, should I be advancing slides? I see that the next slide is not mine, so.
Moira, are you able to advance the slides? Okay, there you go.
No, sure. I just wasn't sure it wasn't my slide, so I wasn't sure if I should advance.
Yeah, I'm not. This is Jerry. I'm not sure what happened to Susan. Do you go ahead and finish?
Oh,
yeah,
I'm sorry.
Yeah, I'm happy.
Yeah, I can do it. So I was talking, of course, on mute like a typical crazy person. I was asking Moira if you could just call in by phone and mute your computer, and we'll move on. And next time you speak, I think we'll be able to hear you better.
Oh, you can't hear me?
You were breaking up. We heard it, but not perfectly. So I'm thinking if you could mute your computer and call in, and we'll just proceed. And next time you speak, I think it'll be clearer.
Okay,
so
great.
The next question we had was asking if any of the first 5 states engaged family, community, or practitioner voice. We already heard a little from New York about that in their planning process, but
Susan,
we'll hear a little bit more about it now. David,
Susan,
did you want to come in?
Yeah. I thought this probably makes sense for me to talk a little bit what happened in Oregon around public-private.
Public-private, okay.
Because I think we were a little, I don't have a slide, but I think we were somewhat unique, right? So there was 4 4 grants directly to Oregon, 3 to advocacy organizations, Children's Institute, and Dana can talk some more about that, Family Forward and Children First for Oregon. And then there was also a national grant to an advocacy to the fight crime, so that was also a partner. But then there was also a grant directly to the state, to the Early Learning Division, and that's basically what created the prenatal-to-three systems fellow position that I'm in. And, I think actually while we were in that sort of grant writing process, there was some discussion about whether that position would be in the governor's office or in the Early Learning Division. I think it ended up being as much sort of funding issues that sort of just determined sort of to put the position in the Early Learning Division. And so Dana should chime in onto this, but I think in Oregon, the Pritzker work, I think, has really been a pretty deep partnership between the public side and the advocacy partners. What I should also say, though, is, I've been sort of the public representative of the Pritzker initiative in Oregon, but of course I, am not always in a position to fully speak for every part of the state and state processes. And I think it's also worth noting, the processes by which the public agenda is formed is a pretty formal process. There's a process by which agencies submit legislative concepts and policy option packages and sort of set timelines for those. There's the process by which the governor's office develops takes into account those agency requests, develops the governor's requested budget, and I think in some sense from the public side, we were really fortuitous in a number of planning efforts that were sort of happening simultaneous to the discussions that the Pritzker-funded organizations in Oregon were having around the prenatal-to-three agenda. So, first of all, our Early Learning Council was in the middle of a very intensive, more than 1 year strategic planning process to develop a new 5-year strategic plan. And so there was lots of hearing from community members, from different state agencies, from partners, from our regional early learning hubs. And so while we were sort of working, the Raise Up Oregon strategic plan wasn't completed yet, as we were sort of working on the sort of shared policy framework, but it was sort of far enough along that I think its contours were pretty clear at the same time. And in addition to the work of the Early Learning Council to develop that strategic plan, the governor had also created a children's cabinet with a prenatal-to-five focus and had pulled together work groups over the course of the summer that involved legislators, community leaders, and other partners to start developing a children's agenda, a birth-to-five, prenatal-to-five agenda for the governor to help her develop her investment priorities for her requested budget. And so that there had been 4 work groups. I worked on 2 of the work groups. I was staffing 2 of those work groups. That had the most close connection, I think, to sort of the prenatal-to-three space. And those work groups had presented to the governor in September. So what I think that, and I bring up all those pieces, I think what that meant is that because of all of that sort of official and public planning process that had been happening on the public side, in conjunction with both with the advocacy partners and community partners, I think that also provided, well, certainly for me, an easier context when working with 4 other partners that Pritzker was funding to sort of talk about what that sort of shared policy framework for the prenatal-to-three space would be. And I think it would actually have been very hard for me to have been having those discussions if those other pieces already hadn't happened and had been in play. Dana, do you want to jump in at this point and add anything on that?
Yeah, can you hear me?
Yes.
This is Dana from the Children's Institute in Oregon, one of the advocacy-funded partners by Pritzker here. And I think the other thing I would add is that simultaneous to developing the Pritzker-funded 0-to-3 partnership, Oregon was also creating for the first time a broad birth-to-5 early childhood coalition to drive a legislative agenda aligned with what the Early Learning Division and the governor were proposing the investment should be in 0-to-5 strategies, in which the 0-to-3 strategies were obviously embedded. And that was a coalition of more than 30, it is a coalition of more than 30 organizations. The steering committee was like kind of 6 or 7 regular attenders. And so when the state goes to engage with that table, it's a pretty big, diverse group. And so I think that the Pritzker table has given us 2 opportunities. One, a table where we're thinking more in depth specifically about the 0-to-3 strategies. And 2, a table that is a smaller group that the state can engage with without looking like they're playing favorites or talking to one advocate over another. It's a legitimized table that the state can come to our group of 4 advocates and have slightly deeper, more nuanced, transparent conversations than maybe you can have with 6 or 7 or 30 or 40 organizations.
Yeah, I would just echo what Dana said. I think part of the opportunity the Pritzker Initiative gave us was, rather than sort of creating a new formal structure, because, both on the state side and on the advocacy side, there were lots of structures in place, but I think it created a context for some additional and more in-depth conversations between the public side and the advocacy partners. I think that's been, really helpful. Just to, give you an example, some of the other structures, during legislative session, the governor's office convenes a weekly meeting with all of the early childhood advocates, and that's a pretty big table, and that's really sort of focused, from the governor's side and on coordination around the legislative session. And I think it's also been helpful, though, to have this sort of smaller opportunity to have more in-depth, and also to use that as an opportunity to, while we've been in the middle of legislative session, to also give ourselves some opportunity and context for sort of making sure that we also have an opportunity to sort of think beyond this particular legislative session and have some of those deeper conversations. Where do we want to go beyond that?
David and Dana, I think because this question of the relationship between the advocacy groups and the public sector leaders touches on so much of your story, it makes sense to just jump to the rest of what you were going to share about how you ensured that your policy agenda wasn't just focused on programs but also addressed big systems issues, which was a big question of the planning grantees.
Yeah, I'm happy to sort of start. As I was mentioning, part of what was also sort of fortuitous about timing is that there had been all of that work that the Early Learning Council had been doing to develop a 5-year strategic plan. And if you look at actually the plan, I think sometimes it's really more closer to a 10-year strategic plan. So I think that had sort of helped us with a sort of long-term vision. But I think there was a couple strategies that we sort of embedded within our shared agenda that I think were also about sort of thinking about how we set up work beyond, this immediate 2-year cycle. Dana, do you want to start with the task force, and then I can talk about Baby Promise?
Yeah, we had included some grounding slides here. So just, in applying for the Pritzker money, we were asked to, I'll let Susan control the slides. We were asked to, put the advocacy strategies in Pritzker's priority buckets, to have a 2-year agenda, and to focus on number of kids served. And I think that, doesn't always lend itself to the bigger picture pieces that we wanted to address, which are developing a long-term strategy beyond 2 years, focusing on both immediate, number of kids served, but also on the systemic changes needed to happen and finally, how to not just increase the quantity of children served, but especially in the infant and toddler space, and especially with child care, the quality of care in which children were being served. And so we had some strategies for how to kind of mesh those or how to kind of navigate those potential tensions. And one, as I mentioned, was this Birth to 5 Early Childhood Coalition. And we just wanted to make sure that all of our 0 to 3 strategies were completely and fully embedded in our Birth to 5 Coalition strategy. And so we had some partners around the table who are more preschool oriented, but the benefit of having them there was now, even though they're preschool oriented entities, they're now advocating on our 0 to 3 agenda as well. And that was a huge benefit, and it allowed the 0 to 3 work to fit into a stronger power structure and be supported by a broader coalition of organizations. And we see this Early Childhood Coalition as a long-term strategy that will last beyond the window in which Pritzker will be granting funding possibly to Oregon advocacy partners. And so using the Pritzker opportunity to make sure 0 to 3 was on this broad coalition agenda hopefully will, outlast the funding cycle. Another key strategy that we use to kind of manage the tension between the short and long term is the advocacy to create an Oregon child care task force. And that really is a system strategy, right? The creation of a child care task force doesn't actually serve any additional children in the state of Oregon with child care services. Instead, what it does is create a long-term plan. And so in our application and policy agenda to the Pritzker Foundation, we made the case to include it in the policy agenda by articulating that there currently are 4,500 infants and toddlers in Oregon currently being served by the child care subsidy program, but by all accounts or by many accounts maybe not being served as well as they could be because of the structural issues with our child care subsidy program and an inadequate supply of infant and toddler providers and inadequate support for infant and toddler providers. And so that's one way that we took a systemic issue that isn't about short-term serving kids now, but made sure we made the case that that was a critical first step to better serving infants and toddlers and child care in Oregon. David, do you want to talk about Baby Promise and kind of how we were tackling quality and quantity, the tension there?
Yeah, one thing I should also mention is the agenda did include lots of investments for specific programs, and actually, in terms of this legislative session, there will be some fairly significant new dollars on the table for programs, including about $25 million in expansion of early Head Start. So there was also a programmatic focus of the agenda, but so these were things that we sort of pulled out of the agenda that I think were more, how do you sort of also think about that long-term focus and focus on quality. And so one of the things that we've been attempting to sort of develop and are in the process of piloting is what we've been calling Baby Promise. And I think Baby Promise is sort of a initiative around building the supply of high quality, accessible, affordable infant toddler care. And it really has sort of about three parts to it. One is sort of developing community plans to identify where are the greatest needs. Although when we had researchers do a review of Oregon's child care supply, it turned out that the entire state of Oregon is an infant toddler child care desert. So we know we have work to do across the state on this issue. But the idea is to really contract directly with providers, including family child care providers, to provide infant toddler child care, but make sure that those contracts are done in such a way that so people are being paid for the true cost of quality, including adequate compensation for the child care provider, and at the same time wrap around professional development supports for those child care providers, and then provide subsidized child care for low-income families. So we're currently piloting this with CCDF dollars in 3 communities. So, at this point, the current pilot will really be supporting about 250 infants and toddlers when it fully gets going. So it's not a huge number of families, but I think the idea was to, rather than sort of focus on numbers, to really focus on what is a full model of how you support quality infant toddler care with all of those components, from funding to professional development to helping families navigate the system. What does that look like? So we're really trying to sort of model on a micro level what a full quality infant toddler child care system might look like. So just through that as sort of one of the strategies that we're at least hoping has much more of an impact beyond the direct number of children and families served in providing a framework for sort of systems change.
Thanks, David and Dana. That was great. We're now going to turn to California and sort of tell a little bit more about its story. And Moira's now on the phone, so I'm hoping that she won't break up at all, which is a very different approach to the prenatal-to-three planning process and coming up with the policy agenda for this grant-funded initiative than the one that Oregon just shared. Moira?
Thanks, Susan, and sorry, I apologize for the earlier Wi-Fi problem. So I think you already saw this first bullet, but I just want to reiterate it, that what you're going to see is our attempt really to put together a policy proposal for Pritzker that reflects the deep work that's already underway in California at the county level, and adding the new opportunity of a very early childhood focused new administration and a variety of funders in California who've been leaning in different ways over the past decade or so, thinking about how to advance an infant-toddler agenda. But I just want to echo all of the dynamics around that Oregon just described around how to move a systems agenda while addressing deep programmatic needs and addressing particular silos within an early childhood system. You just resonated really well, so I thought that was fascinating. But our second, I say because of that, because California has, and First Five has, a very broad early childhood systems building agenda around early quality, early learning, building family resiliency and supporting family resiliency, and comprehensive health and development. So all county commissions are focused on all parts of the early childhood system and filling gaps and building systems. Because we had a broad agenda already in place, the question for us really was how to best use these extraordinary new dollars that were being offered to focus on infant and toddlers, so the Pritzker resources. So acknowledging that those resources are finite in a very large state, and that we needed to meet indicators. Someone said that at the top of the hour. Sort of the proposal is built around meeting indicators, numbers of kids, that going comprehensive in this work wasn't really possible, that we needed to pick strategies that were both aligned with current efforts, aligned with where we hope to be able to most quickly move the administration, and pick strategies that will produce numbers in 3 years. So it meant really seriously scaling back and editing what we saw as a comprehensive strategy in the way that Oregon described it, and picking those pieces that we would focus on in our partnership with Pritzker to achieve results that would really, both be incredibly important for California, but be in alignment with the goals of this initiative. So that's really important, and you'll see that in the strategies that come up next. The second piece is we're all talking about policy, and so I think my way of framing what you just heard about the Oregon strategy is, while the project is about policy and we're all policy-focused folks, the success lies in implementation, right? And so again, it's the flip side of the finite indicators and the focusing on kids. We had to really choose efforts where the implementation path was clear. And I think this is like the struggles that were described in North Carolina or New York at the top about, diverse groups of stakeholders and diverse pieces of the system needing to move. And so we wanted to make sure that in a 3-year trajectory, we're focusing on efforts where we could imagine the implementation path and that it was fairly straightforward. So let me just walk through a couple of those. So I'm going to now, you'll see. I think as many of you know, our approach to the NCIT is to focus on healthy development. So not on quality early learning, and we could have a whole nother webinar on how we engage in early learning and why we didn't put that into this bucket. But in short, there was a lot more momentum, both legislative, even administrative, but certainly local and state public policy around quality early learning. But healthy development was sort of wide open for business, and the First Fives have been building local systems for healthy development for a really long time without state support. So we were really excited about these two goals, connecting families to essential health, development, and social emotional support services, and then increasing the system of supports around information assessment and home visits and referrals. So make sure that we have real systems of supports that wrap around these essential services. So our theory of change was, and this goes back to sort of how California showed up, is to make sure we first described a whole child family-centered California for All system, and that's the governor's term that we're seeing him use in all of his strategies, not just for children, but a California for All strategy to ensure health and well-being, to really focus on mapping the pathways for integrating current systems. So some of our strategies are building on current investments. You'll see us talk about Black infant health in a second, but current strategies that simply aren't effective. This is not unlike the sort of focusing on access on the ECE side, but not on quality. We have a lot of access issues on the healthy development side, and they're simply siloed. Really wanting to make sure that everything we do is focused on sustainable funding streams. For too long, First Fives with their $400 million a year has been focused on, well, the IDA Part C system is really broken, let's just build one that sits alongside, and we can't do that anymore. And then finally, utilizing our existing networks, our First Fives, public agencies, our advocacy coalitions, and our funder networks to test and drive this work. Okay, so I'm going to walk you through our 4 strategies that we finally narrowed down, and we had so many about a month and a half ago. But our 4 strategies, and again, these are going to look a little bit different to some of the other states, but hopefully some of you are also working on healthy development. So first is really promoting the adoption of better strategies for an existing program called Black Infant Health. That's a program that's been around for at least 15 years in California, focused on 13 of our 58 counties with high numbers of African American families living in poverty, and we have incredibly poor outcomes for those families, maternal and perinatal outcomes. So we are going to focus on increasing funding to support programs to reduce preterm birth. We have identified counties that are better than others at doing this work, and we'll be building in many of our strategies, much of our work, building a coordinated support system around those counties, a learning collaborative, and our goal is just to provide 24,000 African American infants with better health services. In addition, a really critical piece of this, and something that's less likely to happen in California, although there is certainly legislative interest, but without some external pressure and support consistent across counties, a disparities dashboard and training on implicit bias. There's legislative interest, but really, honestly, this is not something that a state agency in California can build on its own. So that's our African American infant mortality effort. Second, as I heard in other states, we are very excited about the outgoing administration put the first ever general fund investment into home visiting. First Fives have been really carrying the burden of home visiting in California for 2 decades. And now we'll be hoping to work with the new administration to ensure that there's expansion already suggested in year 1 of the administration, but we'll need that every year of this administration to expand state funding for home visiting programs. And we hope to expand to an additional 15,000 by 2022. But just adding those home visiting programs, we currently have 35 counties with home visiting programs. First Five serves 70,000, just to give you a sense of the scale. To align outcome measures across all the home visiting programs. And then this third bullet, which seems perhaps smaller to those of you outside California, but so important for us, is the McV program in California. So I mentioned that we have 70,000 First Five home visits. We have 1,500 federally funded home visits in California. We think one of the solutions is to expand the allowable models in California. It's a very constrained program, and so every year there's programs that drop out and families that don't get served. And so we really want to focus on thinking how to expand the capacity of that program. Third, we want to focus on more consistent access to health coverage for infants and toddlers. California has been at the forefront, as you probably know, of expanding health coverage before the Affordable Care Act, and First Fives, in fact, were the first to invest in expanding health access to up to 300% of federal poverty level, which is really, really important in a high-cost state like California. So we want to build on our experience at the local level of understanding how to expand access to health coverage, but this obviously will be a state policy. We want to expand health coverage to 90 additional infants and toddlers by making it easier for families to enroll, families with babies to enroll. And then that's our short-term goal, and long-term 2023, we want to really focus on having a continuous access solution in California for babies through age 3, and we think that will increase. We could increase coverage by at least 10,000, but we'll beginning this work with a deep focus on data to understand where continuous coverage, where those hiccups are, and how we can begin to bridge the systems to ensure that families get enrolled and stay enrolled. And then finally, this has been something that really was, I think, the first thing we ever talked to Jerry about. I hinted that our IDA Part C system isn't as awesome as it could be, and our solution till date has been to build county systems that sort of cover over the problems in our early identification and intervention system. So we want to strengthen that system. We are incredibly excited that through the work of the First Fives over the last 5 years, and deep engagement, including legislative work last year that was vetoed or left on the table by the governor, last governor. We have an incentive payment program that will be rolling out sometime next year for pediatric providers to ensure universal developmental screening consistent with AAP guidelines. So this is a huge administrative fix, but that's going to require deep implementation work. So we know that in order for that to work, it's not just that providers need to get trained, which we think First Fives will do much of the work on, no doubt, but we need to make sure that the state focuses on data systems and reporting to make sure that we actually have good data. Right now, just in case you're in this work as well, we have some managed care plans that report 97% of 2-year-olds getting a required developmental screen at the 2-year-old child visit, while we know absolutely that all that is surveillance, not screening. And so we think that through the work that we'll do around developmental screening, we can expect that 50% of infants and toddlers with Medi-Cal coverage will receive screening, and that could be 300,000 additional kids by 2023.
Great. Thanks, Moira. That was terrific. And so you have a real sense of the different ways that states and teams have approached creating the policy agenda and the relationship between the sort of Pritzker guidelines and goals and the big picture vision in your state. And now we're going to turn to another question that many of you raised and hear from North Carolina first about, how did you get to that agreement about what the policy agenda would be? And many wondered, how did you end up not just having a long list of the interests of the many different organizations and leaders who were part of the coalition? So, Michelle?
Sure. I'm happy to kick this part off. So, I think the most important decision we made, well, there were two, but one was that we would operate by consensus. So that, took, it added a lot of weight and conversation to it, but we agreed that our agenda had to be built by consensus. We didn't want any sector or some major organization saying, no, can't do that. So we wanted every member to agree that they would support the whole agenda, and we can talk about what support meant. And to work, and there's another one that had a lot of conversation, on at least one of the policy priorities on the agenda. So where we were aiming was to end up with a consensus agenda that everyone could support, and at least one, if not more, would actually actively work to advance the agenda. We also set some other ground rules for our policy committees, and that was that we would end up with an agenda that was cross-sector, because we wanted to be focused on whole child, so that we would have at least one priority, policy priority from each of the 3 buckets. So we knew we'd end up with 3, but we were open to going as big as we needed to get full consensus. But given that, we were focused only on a 2-year policy agenda. So for 19-20, it had to have urgent need. So we needed to have the compelling case to be made. It needed to build on recommendations from existing sources. So we weren't going to start from scratch and go, oh, wouldn't it be nice if we did this? It had to build on something that was already in place. We wanted to fund or promote funding for effective solutions. So we were looking at, if we were looking at programs, we wanted them to be evidence-based. If enacted, we wanted it to make an immediate difference, and that's something that would take a long time for implementation. And then the last criteria was that it had to be actionable, right? So it wasn't going to be just a good recommendation coming from this group, which is built on all the past recommendations in this area, but it had to be able to be moved forward. And that meant that we had a team, a network, an advocacy strategy, and maybe some willing partners in the governor's office or in the legislature to help us move this agenda forward. So we kept coming back to that. And I mentioned earlier that, we started by a very big landscape scan. So we had over 100 policy recommendations, and it was the job of those policy committees and their stakeholder networks to get down to what ended up being 8 policy priorities across the 3 buckets. So we went through several rounds to reach consensus and a lot of negotiating and bargaining, like, well, couldn't I add one more from this bucket? Or, we could combine these 2 and make it into one. But anyway, every time we broke it back down against this criteria, we could refine it a little bit more. So in the interest of time, I'll just stop there.
Thanks, Michelle. And Abja, how did New York reach consensus?
Sure. So we used a variety of methods to reach consensus. One, I mentioned earlier, we developed a set of guiding principles early on, and that really helped keep us on track and focus. And we would go back to those, when we sometimes as a group, strayed a little too far. So guiding principles were super helpful throughout. Also, really building on the key themes from the landscape scan and the focus groups. I think those both really, the themes that we heard from the organizational interviews as well as the focus groups with parents and providers really helped us hone in on which policy priorities to include. We also, there's a lot of activity going on in New York State in the early childhood space already, and so in thinking about our policy agenda, also we were very mindful of where are there opportunities to support and build upon current initiatives and fill gaps where things aren't happening and not duplicate efforts. And so also, reviewed everything we were taking under consideration with that lens. And then one other method that we used was also thinking about, focusing in on priorities that resonate with downstate and upstate communities as well as urban, suburban, and rural. Given that we actually had a fair number of organizations in our planning committee that do more work downstate here in New York City and the surrounding suburbs, we were really mindful to make sure that we didn't end up with a policy agenda that was too downstate focused and that it would resonate with communities across the state. And similarly, that we weren't too focused on the largest urban areas, but we were thinking more broadly. And so those were some of the key methods that we used. And then the I think similar to North Carolina, our our policy planning work group really took the lead on ensuring that all of these were taken into account as we were fine-tuning the policy agenda, and we brought that back to the larger group.
Thanks. And I think similarly, Ohio also relied on guiding principles and mission and vision as one way. Lynn-Ann, do you want to comment on this?
Yeah, absolutely. I will say for our group, this was not a tough process to arrive at our mission, vision, and guiding principles, but we tried to be intentional about putting this structure around our conversations. And I say it wasn't a challenge because groundwork just based on our internal governance of our organization, many of the key stakeholders throughout the table also sit at our organizational body. Again, like some overlap, some new faces or different faces that we brought in, but because of the consensus we had built last year leading up to this work through our gubernatorial campaign efforts, this seemed to flow very easily. And so you can see our mission and vision. We have a particular focus on equity, and we wanted to make sure that continued to be front and center to all of our work, whether it's 0 to 3 or otherwise. And then these guiding principles, also reflect the framing of our policy conversations. So cross system, I think we've, as a group, we've already talked about enough. Again, looking at equity. So we are, absolutely committed to the metrics of serving 50,000 more kids in Ohio and have that from a programmatic standpoint, know which buckets, how many kids that we believe we can serve out of our 3 main policy buckets. But we also are going to be tracking that by race and rural geography, because both of those in Ohio are very determinative in regards to child outcomes and where our system is at now in serving those children in the first few years. Obviously, data has been a driving factor, and sometimes that eliminate or help evaluate certain strategies. So from our standpoint, what has been a challenge is translating our very large policy document, meaning we have these 3 overarching objectives in serving kids, and we think that having many strategies is a strength, but also, we've had to pick and choose certain strategies to take while building in some flexibility to be able to pivot and be responsive to, for us, what's a really, ever-changing landscape, especially as we are planning during our state budget period. So data has helped drive some of those decisions. And then lastly, I didn't speak in the area where we talked about public-private sector, but because, again, we had a new governor take over at the point where we started our planning, we really used this work as an opportunity to educate and include agency staff and the executives, in a way that we can't during budget time, typically, which is, long-term planning, both on the same page, what are our shared goals and what can we work towards together, versus having a first interaction being, we want A, B, and C. So actually deciding together what advocacy strategies or what policy strategies make sense, I think was helpful. And we had agency staff we now have a Governor's Office of Children's Initiatives. The director there is a cabinet level position, so we had either representation from her staff and other high level agency officials at our meetings. And so again, that's not a completely limiting factor in guiding our policy agenda, but we are also operating in our own political landscape, and we need to choose strategies that we feel that we can be successful with. So having them in the room and sometimes seeing their response can help us guide discussions. The only caveat to that I will say on the private-public sector in terms of these substantive policy meetings we had are, you do have to recognize that having someone like that in the room can change the conversation, and it may impact certain stakeholders more than others. For instance, the way our R&R association at the state level is structured, and the governance of that, they are independent but also beholden to state government. So when you're looking at leadership in the public and private sectors. Obviously, they influence one another and can be really makes a really rich conversation, but it can also somewhat dampen conversation depending upon who's in the room and what the topic is. So I'll end with that, but I think that this was helpful in keeping everyone on track when you're in the middle of a long meeting and you have to cut a conversation short because, it's not serving, while it's valuable, it's not serving kind of the agreed upon frame that everyone is working towards for your policy agenda. Thanks.
Great points. So we've heard some of the lessons learned, but we'll have a little recap from at least some of the states, starting with Oregon, about, what they might do differently or what they really learned from this process. Dana and David? Did we lose Dana and David?
Sorry, I was on mute. I think Dana had to drop off early.
Okay.
So, and I think most of what I'm going to say, I said earlier. Always keeping in mind what your sort of long-term goals are and really where you want to be in 5 to 10 years, I think is incredibly important. I think one thing that maybe I think as a group we could have spent more time on is not just what our long-term goals are and what are our strategies, but what is the long-term theory of change and how are your sort of 2-year strategies really linked up to your long-term theory of change. I think thinking through more explicitly on how how the group was using sort of short-term policy objectives also as a tool for education and political will building, I think would have been a helpful exercise for us to spend a little bit more time on up front.
Great, thanks. And Michelle, North Carolina, what have you learned and what are you still learning?
Thanks. Well, mostly I think we're in the still learning category, but I'll just share a few things I think that could be useful. I think it's really important to create some excitement and enthusiasm around this so that it's not just another think tank kind of group headed out. And so we employed a lot of tools to do that work, really trying to leverage this opportunity that Pritzker gave North Carolina and 0 to 3 combined to really focus in on infants and toddlers. We, of course, wish we had had more time for planning because the step that we skipped, I think, that's important is this big vision and long-term strategic planning. We tried to do some of that, but we really didn't have the time to do that, so we'll be looping back to do that work. But one thing I didn't mention is in North Carolina, sort of in parallel play with our work, our Division of Health and Human Services was creating an early childhood action plan for children 0 to 8. So that we will use as sort of our North Star, I think, now because it has been well vetted and tested, and now we'll see specifically how we aligned. I can't overlook the value of a facilitator and making sure you have a workhorse team, right? So some team that's committed to just moving it forward, keep moving it forward, because there's so many times we bogged down and we could have stayed bogged down if we didn't have this commitment to Jerry and Pritzker that we would get a policy agenda together and start to move it forward. So that is some of those big early lessons. Got just a couple more to share with you. Let's see if I can do this now. We've talked a lot about our policy agenda, but I think it's the piece I would emphasize is starting big. Take a big scan of every possibility. That's part of that consensus building, so no one feels left out or like, why didn't you think about this? We, by virtue of wanting to get something done, we went smaller, and as I just said, we need to go bigger again, right? And most of what's on our policy agenda, we won't actually complete in the 1920 legislative session, but we hope we've made good progress. So how do we build on that? creating a brand for this, I think, is really important if you're working in the early care and education space. NC pre-K or pre-K takes up most of the oxygen in the room. I think you can also find yourself up against other bigger issues that aren't framed in terms of even children and families, let alone infants and toddlers. So in our state, for example, Medicaid expansion is a huge, huge political battle. It's very difficult to get anyone thinking babies, let alone acting about babies in that regard. So we had to come up with some creative ways to get that message in the mix of other issues. So we've done lots of things to get out there so people know who we are and what we're talking about. We've done events, presentations, websites, webinars. We do a ton of social media. And at every meeting we ask our leadership team, what are you doing to advance this agenda, but more than the agenda, just the focus on infants and toddlers, so that we have this continuous process of hearing from people about what's going on out there. Just a couple more, and then we should take some questions. So we probably don't have enough time for all of this, but once you get your agenda settled, all of the work goes into developing a campaign strategy and building that forward. So these are just some of the tools we've done, some of the strategies we're employing to move the agenda forward, even still. So I'm happy to talk about that. We wouldn't be as far as we are without a lobbyist in our state, and we have several lobbyists, really, thanks to our campaign teams that are working on infant-toddler issues. So as always, it takes a combination if you're trying to advance policy and funding of the grass top leaders, and, I think we've got a long way to go in figuring out who are those leaders besides our governor and legislators and pediatricians. Our business community is, in our minds, over-focused on pre-K, but that's where they are. So, lots of work will have to continue on in all these areas. And, I think can't say enough about public awareness and communication strategies and building a grassroots advocacy network. So, we are indebted to Pritzker for making the GMMB work possible and hiring great communications people through the resources we have has been instrumental to at least the public awareness of these issues and why it's so important to focus on babies. So I'll stop there, but happy to take other questions in the future.
Thanks, and we're really at time, so we'll just close by saying thank you to all of you. It was really great sharing what you've learned and what you've done and things you might do differently. And I know that many, if not all, the presenters are happy to answer further questions. If you write them in, we'll make sure to connect you if there's a particular area that you want to follow up on. The next webinar is hosted by GMMB and relates to communications planning. So that'll be an opportunity to sort of gain some of the rich information that Michelle just talked about being so helpful to North Carolina. And that the work of the GMMB webinar will just be a kickoff of their capacity to support you with tools and guidance to help you address the communications section of your implementation grant application. They'll also be at the September 25th through 27th meeting helping you then as well. So you'll be receiving information about that July 10th webinar from GMMB. And then on July 19th at our usual 2 p.m. time slot, we're going to have another Capacity Building Hub webinar on prenatal-to-5 fiscal modeling and how it can help provide a foundation for your prenatal-to-3 efforts. So that's what's coming up, and thank you so much for joining today and for sending in all your questions that structured these presentations. We'll be sending out the slides and the PowerPoint presentations. They'll be put on the landing pad, and we'll send you the link either later today or tomorrow. Thanks a lot.